This is Dr. Greg Raduca, and I'm the Executive Director with Let's Be Clear, Georgia. And I'm very, very pleased to say that joining me on this webinar is Dr. Kevin Sabet. I can't think of a better person to speak on subjects like these than Dr. Sabet. I've heard a lot of speakers on marijuana and a lot of great speakers, but there's just something very special about Dr. Sabet, not only his passion and commitment to the issue, but the extent of knowledge that he has, both in policy education and prevention education, and it's the latter of the two that we're going to be speaking about mostly today. Dr. Sabet is the co-founder and president of Smart Approaches to Marijuana. You may have heard him. He's been on a number of network and cable TV shows. He is connected with the University of Florida and an institute there. He has also served in the Bush and Obama administrations as health advisor. So he has a great deal of knowledge about the national scope, not only of the problem, but also of the solutions to the problem. These are the topics that we're going to be covering today. The latest research on marijuana and IQ, connecting marijuana and school performance and the effects it has in comparison with alcohol's effects. We're going to look at some outcomes, educational in nature, of Colorado's experiment. They're not only experimenting with marijuana, as we'll see, they're experimenting with the academic careers, the minds, lives, and futures of children and teens. We go to marijuana statistics from the Georgia Student Health Survey 2.0. We'll look at the latest 2 years of marijuana-related questions on that GSHS2 survey. Then please write any questions and answers you may have in the chat box, and Dr. Sabet would be very happy to take those questions at the end of the webinar. And if you don't have time to get your question answered, or if you think of a question after the webinar is over, please feel very free to email those questions to me at admin@clearga.org, admin, A-D-M-I-N, at clearga.org, and I'll be very happy to either answer them myself and or get them to Dr. Sabet for his answer. So at this point, I'm going to turn it over to Dr. Sabet.
Thanks, Greg, and I want to thank everybody for joining us today. It's really a pleasure to be on this webinar again with many of you, and really to be hosted by Let's Be Clear, which is just a great collaboration in education on this issue. Very confusing issue, and I think it's an issue that people often bring their own anecdotes to, and they say things, especially in the educational sphere, they say things like, we know plenty of smart people who've tried marijuana and they're doing just fine. So how could it actually be bad for education? Or, we know plenty of people who have used marijuana often and none of these negative life outcomes, happen. And so therefore, all of this must be, reefer madness, and it must be just kind of propaganda. And I think it's important to put a lot of things in perspective when it comes to things like this. For example, we know that most people who smoke cigarettes, even though smoking and lung cancer are inextricably linked, most people who smoke actually won't get lung cancer. That doesn't mean that smoking is not linked to lung cancer. If you smoke, you have a 20 times more likelihood of getting lung cancer than the person who doesn't smoke. And with marijuana, often it's the same kind of relationship. We're not saying causal relationships in every single instance. What we're saying is there seem to be a risk factor that gets increased for some of these negative consequences when marijuana use happens, especially to the adolescent brain. And so I think that that's a really important point to mention because, again, people often think that you mean causality when in reality we're talking about the increased risk. Now, the issue about who's actually using marijuana is very interesting because we hear about the fact that this is not used by that many people, and that actually we're talking about other drugs that are like heroin, for example, that are much more available. And what's interesting is that when you look at the Monitoring the Future study, and this is a study that goes to schools all across the country. It's nationally representative. We actually see that when you look at when you rank the various drugs, the past year use of marijuana is by far, it dwarfs all of the others at 35%. It's interesting. A drug like heroin doesn't even register because there aren't enough. Doesn't make any, I believe it's under 1%. And when you look at the household survey, it's something like 0.1 or something. Obviously, when someone is on heroin and when folks are taking heroin, the risk of death and things like that are so high. That's why it's important and obviously gets a lot of attention. But if you simply look at prevalence percentages, marijuana is by far number one, and then followed by, interestingly, a lot of the study drugs like Adderall, synthetic marijuana, K2 and spice. Comes into third, and then we're getting 4 kinds of prescription drugs right after that. But really, marijuana is the drug that we are talking about often when we talk about young people and illicit drugs. I'm going to talk about probably one of the most important studies that is currently being done with research basically being released on this often by Dr. Amelia Aria. Amelia Aria is one of the country's most foremost experts. She actually couldn't make this webinar, but gave us permission to use a lot of her work and her slides. She's at the University of Maryland, and she is doing some very interesting work where she's looking actually at following college students throughout their entire year, and then throughout their entire tenure, and then looking at 4 years after that to see sort of where they are when it comes to various different practices. So I'm going to be talking, in the first couple of slides now, I'm talking about the college life study because I think it is very important. So the college life study looks at a lot of things. Obviously, there are a lot of things going on when you're in college, a lot of things going on in life. It looks at demographics, different individual characteristics in terms of, let's say, religiosity, how you care about physical health, whether you care about that or not, just your general personality and temperament, which is very interesting, your history of sensation seeking, also stress and social support, and related to that obviously is sort of your peer relations and peer drug use, parental influences, right? So how involved are your families and your parents, your alcohol and other drug use patterns, including perceived harmfulness, absolutely, including sharing or using, selling prescription drugs, and obviously how often you use them, and then things like personal goals and achievement. What is your overall quality of life? Are you working? Do you have satisfying peer relationships around that work? How are your personal goals informing your work and what you're doing every day? And then also mental health, looking at depression, different anxiety disorders, and your access and use of health services. So obviously this is a massive study and it's over a long, but one of the things that informed this study was some work by Martins and Alexandre, which looked at the association of various drugs. In this case, it looked at ecstasy use and marijuana and alcohol and tobacco. And what was interesting is that they were able to divide by low grades, moderate grades, and high grades. And essentially, what showed was that those marijuana users who had actually never used ecstasy had much higher percentage, essentially, of lower grades. The percentage of adolescents with lower grades was higher, so 11% D or less. C was in the middle there at about 25%, and then the rest were high grades. Now, what's interesting is that in contrast with non-users or alcohol, tobacco users, That's a very significant difference. Now, you might be thinking, well, maybe it wasn't the marijuana use, maybe it was, there are a lot of other reasons why somebody who also uses marijuana might, have bad grades. That person could just be a sort of, not just a person that is not, that it just has other, a deviant, someone who's involved with crime, someone who doesn't pay attention, and they happen to also smoke marijuana. These researchers controlled for that. Interestingly, by the way, ecstasy, which isn't surprising, regardless of other drug use. So a lot of these people were using ecstasy and other drugs. It wasn't like they were, had only used ecstasy. Essentially, what they found was that ecstasy was slightly more correlated with lower grades. And again, these researchers did look at other factors, because obviously, you have to be able to control for things like, do they just not like to go to school, or how does this work? But even with this study, it wasn't 100% clear what the direction and correlation was. So there are other studies that were used, that the College Life Survey, for example, used to inform. Let's go to the next slide. I'm going to show you another study on this. Palomar and colleagues in the American Journal of Drug and Alcohol Abuse 2 years ago looked at adverse outcomes of marijuana use associated with how often they used, so frequent use. And essentially every single bar, with the exception of interfered with your ability to think clearly, and that was not significantly different from 40 times versus 10 to 39 times in the purple bars. But other than that, they looked at hurt your performance in school or job. And this is asking people this. So this is like you're giving people the benefit of the doubt, because a lot of people won't admit when there's anything wrong. You're actually asking them whether there's something wrong, which probably means it's an undercount, because there's going to be a percentage of people who don't want to admit that there's anything wrong with their use. So hurt your performance at school or the job, caused you to be less interested in other activities than you were before, caused you to have less energy, and interfered with your ability to think clearly. Essentially, the more often you use, the more problems you had. The one thing was they interfered to think clearly, and that just was a problem. It could have been an anomaly, or could have just been really no difference between 28 and 26 from a statistical point of view. But the point was, for people, for young people, this was high school seniors that had used marijuana 40 times or more, 20% of them admitted it hurt their performance at school. 22% admitted it caused them to be less interested in other activities than they were before. 33%, very interesting, caused you to have less energy. And when you look at how marijuana affects the various parts of the brain, and many of you know the famous brain slide that I often show, it does affect your ability to, your motivation. And we know that, and that's we know that especially when we see people and look at the data among heavy users. But what was not answered by these studies was the direction of the relationship. And this is often what people question. They say, well, wait a minute, are you saying that it's the marijuana use that caused the performance problems? Or are you saying it's the performance problems that caused the marijuana use? And it's difficult sometimes, I think, to unpack that. And that is what the College Life Study actually tries to do. So essentially what we're trying to do is actually not look at one or the other, because that's almost like a false dichotomy. That's not how life works. It's often a cycle. Wherever it starts, it almost doesn't matter where it starts. This, by the way, is very similar with marijuana and mental health issues. People say, well, what's first, marijuana or mental health problems? When in reality, this is often a cycle. It doesn't even really matter what's first. What's important is that substance use, in this case marijuana use, contributes to this cycle of worsening problems. And that is really kind of I think the theory behind looking at the College Life Study and looking really at longitudinal studies that follow people throughout their entire life. And let me just be clear, a longitudinal study looks at a similar group of people for a long time, sort of over time. And and that's exactly what Amelia and her colleagues are trying to do. They're saying there's substance use. It often can lead to academic problems that actually worsens substance use, which worsens academic problems, and then it continues in the cycle of substance use again. I think that's a very important way to look at this versus trying to say, we're going to have causality. Essentially what Amelia is saying, and her colleagues, which I think is very true, and what their research is saying, is that the cessation of substance use is associated with improved academic performance and school attendance. So yeah, the cessation of substance use is associated with the improvement in academic performance and school attendance. So this is the conceptual model that they're looking at with the college life study. And when you look at this, they're looking at alcohol use, obviously drug use, mental health, and what are the processes, manifestations, and outcomes of all of this? It's very important to unpack all of this. First, obviously the intermediate, what happens often first is skipping classes, studying less, the increased motivation that we're seeing, the poor quality and less sleep, which obviously has a lot to do with really your ability to think clearly, and cognitive problems. This manifests itself in lower grades, maybe dropping classes that would have challenged you, that would have been a little harder, that you would have gotten through, that you would have been smarter as a result of taking. Lost opportunities in terms of internships, work, and special studies, etc. And then, of course, long-term outcomes. And the long-term outcomes obviously are what's so important, but we can't forget that there are other things that come along with this. Delayed graduation, failure to graduate, really changing attenuation of goals, lack of readiness for employment, and of course, underemployment. In other words, taking jobs that really you're underqualified for, but you're doing them anyway because you've had drug use and other issues that have stopped you from reaching your goals. So let's look at the survey on drug use and health. We looked at the Monitoring the Future survey, but it is important to look at, all right, if we're going to look at adults here, what happens afterwards, and you're going to look at graduates, some college, high school, and less than high school, what do you have? Well, we see that there are essentially, when you're a heavy user of alcohol on the far left, you are way less likely to have a college graduation or even some college or even graduating high school versus binge alcohol use, which is very interesting. But even with binge alcohol use, it's only 20% as a college graduate. Tobacco use, tobacco, you are, the demographics of those who are using tobacco, or even fewer of them even, are getting college, are college graduates versus past month binge alcohol use. And past year illicit drug use, which is mainly marijuana, you're less likely to be a college graduate. Interestingly, drunk driving, 15% of drunk drivers actually have a college degree, but only 3% of drugged drivers have a college degree, which I think is very interesting. By the way, binge alcohol is 5 or more drinks on the same occasion, at least one day in the last 30 days. Heavy alcohol use is that same thing, but on each of 5 or more days. So obviously it's much heavier. So let's talk about some of the gaps in college enrollment. So let's look at the college life study. This is the gap, some of the gaps that we're seeing. Essentially what we're seeing is among those, so on the left axis you have number of days used in the last month, and then over year 1, 2, and 3, and 4 of college. There is a certain percentage of young people, in this case about 7%, 6.7, that have chronic heavy use throughout their college. It starts a little less in year 1 and then ramps up. 7.5% have increasing use. They use more in year 4 than year 1. 5% have decreasing use. And the rest, which are about 80%, either have infrequent or minimal to no use. So obviously the vast majority of people in college have no use, but a very significant proportion have increasing use, which obviously is problematic. So let's talk about how marijuana actually, this idea of stop out, how it affects your use as you're going up. Essentially what this happened is that chronic and heavy marijuana users were twice as likely as those minimal users, the ones that really barely ever use, to have discontinuous enrollment. In other words, to stop being in college and then have to start again, or either stop and not start again, even when you control for demographics, personality, and high school GPA. So this is a very similar person in year one coming into college. And essentially the heavier users were twice as likely to disengage from college, to have discontinuous enrollment than minimal users, even though it's the same sort of demographic. Drugs other than marijuana, we're talking cocaine, heroin, etc. High-level drug use were also twice as likely as minimal users to have discontinuous enrollment. So it's a very similar number between marijuana and other drugs, which is interesting because people think it's just, well, yeah, if you have cocaine use in the background or other things, obviously that's going to cause, problems, and you're going to, but marijuana, of course, many people say, well, that doesn't affect your college life at all. This is actually saying, no, in reality, this is really a problem, and it's a problem. Marijuana is just as a problem as these other issues. So let's look at marijuana and alcohol use in terms of their relation to discontinuous enrollment. Essentially, first-year alcohol use and frequency of marijuana use was related to late discontinuity, even after controlling for all the kinds of demographics we talked about. So, early discontinuity, leaving on year 1 to 2, was about 9% of marijuana and alcohol. But 20% of those who were using marijuana and alcohol had years 3 and 4 where they dropped out. 70% stayed continuously enrolled. But that is a very big chunk. We're now saying that a third, about 29% of college students are going to be dropping out, who have the more often they use free alcohol and marijuana, which I think is very interesting. And this is what Amelia and her colleagues found. We're not just worried about whether they graduate high school, graduate college. We're also worried about, well, what about later in life and their trajectory? Essentially, we are seeing another relationship with how often you use and whether or not you're going to have financial problems, whether or not you're going to be financially independent. This is another group of researchers not connected to the college life study that essentially found that the more often you used, the more likelihood you had of financial problems and the less likelihood you had financial independence, which I think is important. So let's talk about why. I sort of talked about the brain issues very briefly, but let's talk about why this is actually a problem. First of all, there's a toxic effect on cognition. Okay, we know that substance use affects the direct parts of the brain that are associated with attention problems, sleep disturbances, and other cognitive effects, which essentially make classroom learning, studying, and homework a lot more difficult. So in adolescence, for example, alcohol use, which is important to look at, is associated with many, many negative aspects. This picture has these construction workers. Your brain is essentially under construction before you turn 30 years old, and that means alcohol, marijuana, other things all affect it. So in adolescence, heavy alcohol use is associated with structural changes in the brain, differences in sleep patterns, poor planning, impaired executive function. Executive function, by the way, which is the front of the brain, that develops last. So, it sort of tells us why 15-year-olds make really dumb choices often, because they're functioning about what makes sense to do is impaired. Spatial defects, obviously, and attention defects. What about marijuana use? Well, very interesting. Acutely, marijuana use is associated with attention and concentration difficulties, a decreased working memory, decreased information processing, and decision response speed. And again, when you think about how many of you who have classrooms and are teachers or working in the field, when folks are using marijuana frequently, there are often problems with reaction time, with remembering things, responding in a timely manner, because your brain is essentially slowing down. Now, longer term, we see impaired planning, organizing, and problem solving, deficits to the allocation of attentional resources, filtering out irrelevant material, and retrieval and immediate verbal memory deficits is a huge issue among those who frequently use marijuana in the long term. The deficits are more likely when marijuana use is earlier in life, and it's when it's more frequent. And there was a very famous study by Madeline Meyer, which essentially said that early chronic use of marijuana is associated with an 8-point loss in IQ. And how they did that was they did another one of these longitudinal studies that I was talking about. They essentially went and found, basically, they went and said, all right, we have a group of people who use marijuana frequently, who started when they were young, a group of people who don't. Let's control for all the factors, and let's see what happens. Now, what's interesting about this is that it was very controversial in the literature by a few people who sort of said this can't be true. They tried to discredit it with their own article, and then, interestingly, NIDA and Dr. Nora Volkoff had a response to say, no, actually, you didn't discount it. The findings actually still hold. And then there have been other studies published by Jackson and colleagues recently saying, no, this isn't really related. So it remains a debate, but I think the majority of the evidence with researchers that I've seen and seen their letters and heard their work on this is that they absolutely are sticking to the fact that this can reduce IQ and it's associated with declines. Actually, we have a video of Madeline Meyer talking about this. Can we play that video?
We asked whether persistent cannabis users lost IQ points from childhood to adulthood. We found that people who started using cannabis as teenagers, by the time they were 38, they lost about 8 IQ points. We studied about 1,000 people who were born in Dunedin, New Zealand in 1972 and 73, and we followed them up approximately every other year, all the way till they were 38 years old. When they were 7 to 13 years old, we gave them IQ tests. Then we assessed their cannabis use from the time they were 18 to 38, and then we gave them IQ tests again at 38. So we could look at their intellectual functioning in childhood before they began using cannabis, and then again in adulthood after some of them had already been using cannabis. We found declines across measures of mental function, so not just IQ. We looked at memory, executive functioning, which is the ability to multitask, plan ahead, processing speed, reaction time. We also looked at whether informants noticed cognitive problems among persistent cannabis users. So we didn't just look at standardized tests, we looked at how people were functioning in everyday lives. And we found that informants noticed more cognitive problems, attention and memory problems, among persistent cannabis users. In this study, we've defined persistent cannabis as dependence on cannabis over multiple years. And dependence generally refers to using cannabis despite experiencing problems associated with cannabis use. Those could be physical health problems, legal problems, or relationship problems. So we looked at it in 2 different ways. We looked at persistent cannabis dependence, but we also looked at persistent regular cannabis use. And we defined regular cannabis use as using cannabis 4 or more days per week. Regular teen cannabis users who stopped using later in life by adulthood, they still showed. So quitting use as an adult didn't result in recovery of IQ function. We don't know when the damage is done, but we do think that the damage is lasting. Our findings that adolescent or teenage cannabis users show IQ decline are consistent with other studies, both animal and human studies, suggesting that adolescents may be particularly vulnerable to the effects of cannabis on mental function. We wanted to know if there were perhaps alternative explanations that could account for this finding of the effect of cannabis on IQ decline. And so we looked at some of the most obvious potential alternative explanations, such as recent cannabis use the night before neuropsychological testing at age 38, alcohol use or other drug use, tobacco use. And what we did is we took all of these factors into account. And after we took them into account, we still found that persistent cannabis users showed IQ decline, suggesting that none of these alternative explanations could account for the findings.
I think that was a great explanation of that. And again, there's been some controversy, but I think it's been very, very clear, and this showed in other studies, that this holds. But you know, it will continue to be an issue among among some people, because some of the researchers just don't want to accept it. Just by the way, the Jackson twin study, it followed participants up to age 20 at the oldest, while the study that you just heard about, New Zealand, the Madeline Meyer study, followed them up until age 38. So the New Zealand participants actually could have accumulated more years of heavy use than was possible in the twin study, which is the one that Jackson did. Some people, again, want to say that this new Jackson study negates the findings of Meyer, but many of us do not think that it does at all.
Dr. Volko of NIDA is certainly one of the most respected substance abuse researchers in the country, if not in the world, and she supports the results.
She does. So I also wanted to mention this because some people were asking about, what's the relationship between non-medical prescription use, because we hear so much about the opiate epidemic and prescription drug use, which obviously we should. Very interestingly, numerous studies reported past year prevalence estimates for marijuana use at 85%, meaning 85% of those who actually had non-medical prescription drug use also had marijuana use. So oftentimes these are things that are often used together, and there's going to be some new infographics and things that Sam is going to be putting out to make this link stronger, because we think it is a very important. In fact, maybe we just came up with a new webinar topic to talk about the relationship between opiates and marijuana, because that's something that I think a lot of people are often talking about. So, we'll see if you all think that would be helpful. Please let us know. But there's no doubt that there is a link, and we get sometimes caught in, saying things like, well, is it gateway? Is it not? What is it? And we don't actually, we caught in that lingo versus actually looking at the research, which does show a very strong connection. So I think that's something we should explore maybe later in another webinar. What's interesting is, what about the prescription stimulants for studying? This is very, very interesting. Amelia and her colleagues are in their work, they're connecting those two things, and I think it's very important to do so. So basically, if you look at the top left, marijuana use leading to marijuana dependence among heavy users, which then leads to, which is also connected to the non-medical use of things like Adderall, which is then connected to skipping class, which is, it's in both relationships, because when you're dependent on marijuana, you're also skipping class, meaning you think you need Adderall and other stimulants to help you compensate for missing class, and your academic performance goes down over time. I think it's a very important link that we haven't really been talking about as much in society, but the issue of marijuana and drugs like Adderall, etc. So what we suspect is that marijuana and other drug use might be driving academic problems, and the non-medical use of stimulants like Adderall is a compensatory behavior, in other words, a shortcut, and really it's largely unsuccessful. It's just trying to have a shortcut with these drugs has not been successful for most people. They think it is, but in the long term, this is really affecting. The issue becomes their marijuana use is affecting their outcomes especially if they become frequent users. And I think that's a very important point. Again, we're not saying every student that's going to happen to, is going to happen like that, but we're saying for a lot of them, this is a very, very, this is a very clear issue of importance. Next slide. I think I am finished. I'm going to pass it on to Dr. Raduca to talk from the HIDTA report in Colorado to talk about what we're seeing with youth past marijuana use in Colorado and how these policies can lead to some of these negative outcomes that we've been seeing by increasing access and availability. So, Dr. Raduca.
Thank you, Dr. Sabat. And Dr. Sabat will be here until the end of the webinar in case you do want to submit any questions for him. But this is an incredibly impressive report that Tom Gorin from Rocky Mountain HIDTA has put together for the last 4 years. Volume 4 has just come out. If you want to access the executive summary of the report or the full report, it's on the home page of our website, which is clearga.org, clearga.org, and you can just look for the executive summary because it is quite a lengthy report because so many negative consequences are occurring in Colorado due to their experiment. Youth use, very unfortunately, is one of the most tragic effects of the experiment. Increased 20% in 2 years since Colorado legalized recreational marijuana compared to the 2-year average prior to legalization. More from the Rocky Mountain HIDTA report. Youth past month use in 2013-14, 74% higher than the national average compared to 39% higher only a couple of years before. So an incredible increase compared to the national average. Latest results showing Colorado youth ranking 1 in the nation for past month use, up from number 4 a couple of years ago, up from number 14 8-9 years ago. And one has to remember too that Colorado, in some ways, you may think, Georgia's nowhere near that. Colorado has legalized recreationally. Georgia will never do that. Something that is important to recall is that the majority of witnesses, many of the witnesses that have been heard by the Marijuana Commission and study committees over the past couple of years have been from Colorado, and a delegation from Georgia went to Colorado at the request of the sponsor of the medical marijuana bill this past year to see what it was like. Very fortunately, that did boomerang, and members of the delegation that went were in some cases actually disgusted by what they saw. So that trip to Colorado was actually a good thing. The Colorado Department of Education began collecting marijuana violations separately from all drug violations, so we only have data from the 2015-2016 school year, but already it's quite revealing. This really harkens back to Dr. Sabat's slide showing how much more marijuana was being used than the other drugs, with the 35th percentile up at the top. But here you have 63% of all drug-related suspensions were for marijuana violations. You think that might have been an alcohol stat, but it's not. 58% of drug-related expulsions, getting more serious than the suspension, of course. 73% referrals to law enforcement. So, many think that marijuana is a love drug, and it can be, disturbing, but doesn't cause disturbance. Well, apparently it does, at least in Colorado. More from the report. It's an interesting correlation here that the top 10 states for the highest rate of current marijuana youth use were all medical marijuana states. And my understanding from an email from someone with HIDTA, who's one of the analysts for the report, says that this is also true for young adult and adult use. The bottom 10, all non-medical marijuana states, that will probably be changing since Louisiana just became a medical state, and they're included in the bottom 10, but that is for the future. Colorado school dropouts. It did go down with a 1% decrease for 13-14, but you can see there a sharp increase of 5% in 2014 and 15 as things really get going in Colorado. Georgia has an incredible website, probably the best in the nation, that features data from the Georgia Student Health Survey 2.0. And this is a mandated survey for students in the 6th through the 12th grades now. And several of the questions from the GSHS2 deal with marijuana. So question 54 on that survey, which also is available on the website, you can see all the questions, talks about 30-day use. And we have 14% use in 2014-15, and it did drop a bit, and that is in line with some of the national data. But as Dr. Sabet has talked about, especially once you get to the college years, which is right after being a high school senior, the stats go way up. Talking about perception of risk here, which is similar to the perception of harm that marijuana can cause. And you'll see in these perception of risk stats that 40.7% of seniors in this year's report reported that they didn't feel like there was any risk even when somebody is smoking once or twice a week, or in other words 4 to 8 times a month. And given the strength of marijuana on the street today, that can really have an effect on somebody. So slight risk, 19.3%. So there's a total of 60% there. And that is a lot of kids thinking that marijuana either doesn't do any damage or very little damage. And again, it's even a little worse than that. In the talks that I've given, so many of the student audience think marijuana is a medicine. So not only is there little to no risk, it's even good for you. You can see the stats. The stats have been pretty flat from last year to this year, 60%, but it's an alarming flat stat. Interesting question here. How wrong do your parents feel it would be for you to smoke marijuana? And of course, this is the perception of the students. It's not a report from the parents themselves, so you do have to take it with a grain of salt, but still, you get quite a high percentage, almost 1 in 5 in this year's report, 20% in last year's report, thinking either their parents think it's just fine or it's only a little bit wrong. So again, another alarming stat. We have a few minutes for some questions and would love to respond to them if you have a question. Please don't think that any question is too simple, because no doubt 5 or 10 other people listening to the webinar have the same question. While we're waiting to see if there are any questions, let me put in a plug for Dr. Sabet's website, learnaboutsam.org. Learnaboutsam.org. It's an incredible website with incredible resources, as is clearga.org. And on clearga.org, you can find educational tracts that Dr. Sabet has helped us to write. And those tracts are multimedia tracts, many of which contain videos as well as recent news articles, source-referenced scientific data, not anecdotes, that can really help you in 20 areas related to the effects of marijuana. One of those tracts concerns educational outcomes, and the full video of Dr. Meyer and also a video of Dr. Volko is on the educational tracks. So if you want to see that educational outcome track, you can go to clearga.org on the home page, scroll down, and you will see all 20 tracks. And again, the educational outcomes track is the one where Dr. Meyer and Dr. Volko videos are featured. We also have a November 2nd training and meeting coming up at the Loudermilk Center, which I want to invite everyone to. Judge Glenda Hatchett, who is a speaker at the Georgia School of Addiction Studies that some of you may have attended, will be our featured speaker. That's on November 2nd. Those of you who are on our email list have already received an email talking about saving the date. If you didn't receive an email and would like to attend, please email me, that's Greg Reduca, at admin@clearga.org, admin@clearga.org. In addition to Judge Hatchett speaking, we will also have a training on advocacy, which I think you'll find extremely helpful, extremely useful, and very effective.
Okay, so we have a couple of questions that have come in.
Okay.
So the first question is, what was the source for the RX drug use and marijuana connection?
Great. That source, I believe, was the National Survey on Drug Use and Health, but I will double check that. And if it's not that, I will let you know. We'll put it on the website. But I believe it should be. It's either going to be National Drug Use and Health, or it's going to be Monitoring the Future. I think the bottom got cut off there, so I don't have it off the top of my head, but it's going to be one of those two.
Great.
And we will put that on our website, where you can find all the recorded webinars on the clearga.org site.
So the second question is the increased youth use in Colorado mean 12th graders?
Yes, that's high school seniors.
Sorry. Yeah. I think which stat are they talking about? Because the one that Colorado is number one, I mean, it's including high school seniors, but it's the NHIDTA study of 12 to 17-year-olds. So it's actually all teenagers. Well, 12 to 17.
Right.
The next question is, have you heard of the Clarkston ordinance where they are now giving a fine of $75 for possession of less than an ounce of marijuana? How would you address the group if they continue to try to do the same for other cities?
That is a great question, and that is something that we'll be addressing at the advocacy training on November 2nd. It's a very difficult challenge. I've heard that Gwinnett County is all a similar ordinance. Decriminalization can be a great thing, and I know Dr. Sabet and myself are not opposed to decriminalization. It can be a very good thing in lieu of criminal penalties, especially if there is possession of less than an ounce, especially if youth are involved, because we don't want to see a youth's record ruined for life. We don't want to see them not be able to get a college loan, for example. However, if decriminalization means just a slap on the wrist, just a fine of $75 and nothing else, then it's really of no value and can also hurt young people if they think that all that happens for marijuana possession is a slap on the wrist. The public health model is so much better, and we tried to convince the Clarkston mayor, city council, to go with a public health option where there would be what's called administrative sanctions rather than criminal penalties for minor possession, where they could have an alcohol and drug evaluation, and if that evaluation should show dependence, then a treatment alternative could be made available. If that evaluation should show abuse, then an educational alternative could be made available. And there are a number of programs that are going on at the DeKalb Juvenile Court, for example, that an adolescent and his or her parent could attend that could really be helpful in cases like that.
Yeah, obviously, just a slap on the wrist, as Dr. Reduca said, and decriminalization is not going to be, especially if it's not paired with an awareness
campaign about why this is not harmless. We're not saying that because we don't want to give you a criminal penalty that therefore it's harmless. I mean, this is where we need comprehensive public health policies, and the public health policy would have a massive awareness campaign on the scientific harms as well as the sort of quality of life harms and outcomes of marijuana. So you can't. So my advice to the folks in the community would be, okay, if you want to give people a $75 fine, how are you going to communicate to young people that this doesn't mean that marijuana use is okay, and that actually that this is a big problem for young people? And how are we going to have a youth advocacy campaign, and also, by the way, parent advocacy, because parents have the wrong idea completely. And so, I think my question back would be, all right, you want to do that, but what are you going to do to inform people that this is actually not harmless?
Okay, the final question is, could we possibly have access to this presentation in PowerPoint format in addition to the video when the webinars are made available on the Clear Georgia site?
If I'm understanding the question correctly, you will have access to the entire PowerPoint. You'll have access to this narration of the slides from Dr. Sabet and myself. So you will have complete access by going to clearga.org.
That's correct. And both handouts will also be available with the video as well. And that's all the questions that we have for now.
All right. Well, great questions. And again, if you have additional questions that you think of after we hang up, please go ahead and email them in to admin@clearga.org. It's been a pleasure to be with you this afternoon. Thank you so much for being with us. Thank you so much for your interest and commitment. I know that we have many committed members of Let's Be Clear Georgia. If you'd like to join, we would love to have you as a member, and you can join our collaborative. We're now 335 members strong, simply by going to the website, and you just click on the button that will indicate the next steps to take to join the collaborative.
Thank you, everybody. No, I appreciate it, and I'm going to see some. We may want to mention on October 7th, we're going to be seeing some of you on October 7th, and we look forward to that. We're going to go through some of our education issues that we've done, as well as talk. I'm going to do a keynote there. I believe Congressman Kennedy is going to be there the day before too. I'm not going to be there the same day he's going to be there. Unfortunately, we're going to miss each other because I'm going to be flying in from California. But we look forward to seeing some of you there as well. So thank you.
Well, I hate to say this, but actually that symposium is all full, and right. So there's even a rather long waiting list. I hate to say that, but we'll certainly be bringing Dr. Sabet in to speak in Georgia again, and we'll let you know when that occurs, because he is a fantastic speaker.
Thanks everybody. We really appreciate everybody's support.
Thank you so much.
Okay, bye-bye.